Now we're going to talk about the portion of the mommy makeover that most people know, and that's the abdominoplasty. The abdominoplasty is a way of correcting the loose skin and separation of muscle that occurs after pregnancy. The abdominoplasty is also known as a tummy tuck. Now, the tummy tuck procedure, in the tummy tuck procedure, you make an incision about an inch to an inch and a half below the pubic hair, and it goes out to the hip bones. Then you make you dissect all the way up to the rib cage, and at that point you sew the muscles together that have separated from pregnancy. So you do a figure-of-8 stitch from the belly button to the pubic area, and from the belly button up to what's called the xiphisternum, the real bottom of the sternum where the ribs come together. And you sew the muscle together, and then you do a second layer above that with what's called a running locking stitch. So you run it all the way down from the belly button to the pubic area, from the belly button to the xiphisternum. So you've got a two-layer closure, and I use permanent suture, and you want nice big permanent suture so things stay together until your body can replace the suture with scar tissue. And then what you get is you get a permanent internal girdle, so when everybody else is sucking their stomach in, you won't have to because the muscles are sewn together. The next part of the surgery, and this is really important, is the belly button. We cut around the belly button and we drop it inside, and then we remove all the loose skin. The belly button has two blood supplies. There's one from the skin, of course, but then also there's one artery and two veins from the liver. That's how your mother fed you when you were inside of her. So the belly button with its three vessels, actually two veins, one artery, is cut around, dropped inside, then you dissect all the way up. Don't mess with the belly button. And then the next stage, you actually anchor the belly button down to the abdominal wall, what's called the rectus sheath. And the reason you do that is you want the belly button way down deep, and so that when you sew the skin down to the belly button, the skin goes inward, and it's called to umbilicate, because another name for the belly button is the umbilicus. So you umbilicate the skin, so if there is a scar, the scar is below the horizontal, nobody sees it. So we want the belly button actually hooked tightly to the abdominal wall. My trick, once I've anchored that skin to the abdominal wall, and I've sewn up most of the belly button, cutting out the extra skin, of course, is I take a needle on a thing called a sponge stick. You take it and you put it right on top of the belly button, and you push down on the abdominal skin, and where that needle comes out is exactly where you want to have your belly button. Belly buttons are not a midline structure. So if you draw a line from the xiphisternum down to the cleft in the labia, you're going to find it's usually a little off to the right or off the left by a few millimeters. No big thing, it looks completely normal. But if you find that your belly button after surgery is not directly in the line, that's because it never was. You just didn't notice it before.